Okay, good morning, Yasmin, and thank you so much for being a part of my class. This video will be recorded. Do I have your permission to submit it? Yes. Okay, thank you. So today we're going to learn how to potentially save a child's life. We are going to learn how to administer asthma first aid to a child in an infant care setting. Asthma is a chronic health condition. It is one of the most common reasons for children to be hospitalised. Correct asthma management will assist in minimising the impact of asthma and allow the child to continue to live a normal life. However, children in our settings under the age of six do not have the skills or ability to recognise and manage their own asthma effectively. It is important all early childhood professionals understand how to manage a child's asthma in the event of an emergency. So that's what we're going to learn today. Okay? Alright, before we begin, I would like to acknowledge the traditional owners and custodians of the land, the Yorta Yorta people, on the land of which we meet today, the 8 clans of the Yorta Yorta Nation. I would also like to pay my respects to the elders past and present. Okay, can you tell me, have you ever had any experience with needing to administer a child with Ventolin before?
Yes.
And how did you feel? Was it scary or did you feel confident?
It wasn't scary, it was just had its own challenges, different to administering it to older kids, I guess, in terms of they don't sit still, they are crying or they're scared and that sort of thing.
So hopefully I can
it's hard to explain it to them that how they
need to remain calm and yeah, it's quite scary when a child is unwell in any way. So have you got asthma, or do you know anyone in your family that has asthma?
I do, and also have family members who have asthma, so yes.
Do you ever remember when you were little having an asthma attack or feeling scared?
Not so much when I was like really young or anything like that, but it's definitely not a nice feeling to have any sort of restriction in breathing.
No, absolutely not. So, in our daycare setting, we have our asthma first aid posters that are set up. So if a child does have asthma, they will be sent. They cannot be dropped off at the daycare service. They cannot be dropped anywhere without having a management plan and their reliever. So if mum pops in one day and forgets to bring the asthma puffer, she must take the child back with her and then return the child with the asthma puffer because it's just too dangerous. We don't just have standard asthma puffers lying around, so every child needs to have their own. So by the end of this session, I am hoping that you are confident and I've given you some skills to administer to a small child in a daycare setting. So why do we need to know how to provide asthma management? Do you know why that would be something that early childhood professionals should learn?
Why we need to know how to do this?
Yes.
Well, I guess if we're responsible for children, then we should know how to administer something safely when required, and I guess to make sure we can know what signs and symptoms to look out for, because I think from my understanding, like asthma can present in different ways initially, so I think having a better understanding of how it works and what to look out for and how to administer medication and the protocols is best practice.
So our steps. So a big thing as well when we are providing medical first aid to a child or to anyone in general is to make sure that we have our safe environment. So even today, like conducting this lesson, we need to make sure that we are safe. There's not any cords we can trip over. There's, we're not going to put a child up on a high surface that they could potentially fall off. You need to be careful of when you're lifting a child as well, that you're lifting properly and carefully. So just being mindful of all of that. So do you feel that you're in a safe environment today to conduct this? Awesome.
Yes.
Absolutely. Well, so our structure of our class, I'm going to explain first aid first, then we're going to do it together, then I'm going to let you have a turn by yourself. So I have brought along a little child today. She sometimes does as she's told, and it's a bee who we practice on. So, it is quite a lifelike doll that is quite floppy. So if a child, we need to make sure that we are making sure that we're holding it properly or that we're asking for help. So this is probably something that you would ask for assistance with. But if you're by yourself, you need to know the skills. Okay, so let's have a look at the task breakdown that I've given you there. So we go through it. So the first one. So first up, you will assess the child, obviously assess your danger. So if the child is in immediate danger, you're going to try to eliminate the danger, but you're going to call 000 straight away. So if they're not breathing, they're suddenly becoming worse, or they're not improving. If you don't have a reliever, or you're not sure where they are, or if you're unsure if it is asthma. So it could be a food allergy, it could be an insect bite, it could be poisoning, it could be anything. So if in doubt, dial 000 first, and then we then sit the child down. The entire time that we're doing this, we are talking calmly. You know, inside we might be freaking out, but we are calm, we are reassuring, we're just stepping through, we're talking to the child, we're using their name. You might at this time ask the staff member to call their parent. You won't ever leave the child by themselves. Then second up, so then this is when we introduce our puffer and our Ventolin. So we've got our Ventolin, our grey or blue reliever. You can shake it down the bottom. It has how many puffs are left available. You can check that it's in date. So the date is up on the back, up the top there. So you would never administer out of date Ventolin. And it's just one puff. Well, shake it first and then one squirt, and you can see the Ventolin comes out. This is a mask. So this is a pediatric mask. So for small children. Some spaces don't have it, but a mask is a bonus. However, the main thing that we want is a spacer. If we don't have a spacer, which can happen if we're out and about, sometimes mum just has, you know, a puffer in a handbag. So we just want to take one puff in, very slow, deep breath, and hold the breath for as long as you can make a child hold their breath for. That's going to be tricky because kids don't do what they want to do. So repeat until all 4 puffs are given. So what we want to do, we want to make sure that our hands are as clean as possible. We want to put the mask onto the spacer. We want to shake the puffer, place it into the spacer and give one puff. And then the child will then be breathing in. So if you had the baby, you would have one puff, you would see a big puff in and it's over their face. So puff, and then you're not going to move it away. You're going to keep it on their face until they've taken 4 big breaths. You're going to repeat this 4 times. So one analogy is 4 by 4 by 4, which the Asthma Council uses. So you do 4 breaths, 4 puffs, and then you wait 4 minutes. So you wait 4 minutes. If you see that the child is not responding, you then do another round. And if that time you already called the ambulance, or this would be a really good time to call the ambulance. So if breathing does not return to normal, straight away you're going to continue. You're going to continue doing your 4 breaths, 4 puffs, but you are going to go for the advice of what the ambulance is telling you from there on. And you're going to wait for the ambulance. In a childhood setting, once we have administered Ventolin to a child, we then must write an incident report, and a parent has to sign that and cite it. So a parent, must be contacted immediately, especially if there's any breathing problems. So, have you got any questions about what I've just showed you?
No, I don't think so. Yeah, I think it's, I think it'd be really hard to administer without the mouth, without the face covering for the mask.
Yeah, absolutely.
For little kids, because at least if they're crying and stuff, they're still breathing.
Yeah, and so you can sometimes hold it in too, so.
Yeah, just because, I think it'd be really hard to get them to hold on to the end of the thing otherwise,
Alright, well, we are going to watch a little quick video just about how to administer asthma first aid to a child. Just on YouTube here, so I'll just, can you hear that? Are you sitting? Your neck's not hurting? You can see it, not straining. Hold on, I'll just turn it up a little smidgen. Okay, start again.
An asthma attack can be frightening for both you and your child. It is important to remain calm and sit your child upright. give reliever medication. All reliever medications are blue. Shake the blue puffer and take the cap off. Use your child's spacer. How to use a spacer is explained in another section. Puff one puff of medication into the spacer.
Slow breaths, ready? 1, 2, 3, 4.
Watch your child take 4 effective breaths.
Very good.
Repeat this step 4 times until your child has taken a total of 4 puffs of medication. Wait for 4 minutes. At the end of 4 minutes, look at your child's breathing. Do they look and feel better? Is there any improvement, or are they still breathing faster or harder than normal? If they are not better, give another 4 puffs of reliever medication as before.
4 breaths slowly. 1, 2, 3, 4. Good boy.
If your child is not improving, you should seek further help. It is difficult to give general advice. However, acute asthma that is not responding to reliever medication is a medical emergency. Dial 000 and talk with the operator.
Hello, ambulance. Yes, my 2-year-old son's having an asthma attack.
Continue to give 4 puffs of reliever medication every 4 minutes until emergency assistance has arrived.
Come on, 4 breaths slowly. Ready? 1.
Okay, what did you think about that video? Did you think that they explained it thoroughly?
Yeah, I mean, it was, it showed what to do, how to manage it in a real life situation.
Did you notice in the video?
Mother, remained calm. They administered the medication, they used a mask, the puffs, it was all, the 4, 4 and 4 was explained well.
So, and that's an easy thing to keep in your head is 4 puffs 4 times 4 minutes, and then repeat it 4 times. So 4 by 4 by 4 by 4.
Mm-hmm.
Another thing, did you notice when the little boy went to put the spacer on his face, and the first time, and he did this, so he wasn't getting long, deep, and then the second time she said, long and slow down, be calm. And Mum did a good job too, so she remained really calm. Also, often, so that was a mum at home, which, asthma doesn't discriminate. We're going to have an asthma attack any place, anytime, but sometimes it's easier in an early childhood setting because you do have backup. So, you can say, can you please come and help me? Can you get someone else? So, but yeah, that mum did a good job. So it's very important, remain calm. So on your task breakdown sheet there, you can see, on the sides, I've written things like key points. Make sure that you're assessing for danger, but make sure as well that we're remaining calm. So always, using the child's name. So hi Sophia, you're okay, you look like you might be struggling a little bit, but babies sometimes distraction. So the more worked up they get, the harder it is for them to breathe, and the more anxious they become, and things take a turn pretty quickly. So with a small infant, you could sit them upright on your knee so you can hold them. For a child, from 3 to 5, you'd sit them up against a wall. I don't think it would be a great plan to sit them up on a surface or a table. Could you tell me why?
Well, just for a falls risk, I guess. If they, if things don't improve, then you don't want them stuck up on a table. You won't be able to leave them. If they end up having a seizure or something like that, it's just probably safer to have them on the floor.
Absolutely. If your 4 puffs haven't worked and the ambulance haven't arrived and the child stops breathing altogether, what are you going to do? What do you think the next move would be?
Probably to start CPR, so that's why they need to be on the floor so that they can be...
So commence CPR. If it's a baby, to commence CPR, we commence CPR on a table. So something with a flat, hard surface.
Mm-hmm.
All right, so I'm going to step you through together. I'm going to demonstrate how I would do it with this small infant on my knee. and then would you feel confident in having a turn?
Sure.
So you can have a turn and I can help you. I'm here for any questions. Have you got any questions so far? Very diligent student.
No, not at the moment.
Not at the moment. Okay, so I've noticed that Sophia here is starting to breathe a bit raspy. So also in early childhood we do have things called medical management plans, which is something that the director will discuss with parents upon enrolment. We'll talk about their triggers. We'll talk about things that may escalate them, and it's also important. It's mum and dad's responsibility when they drop the child off to let us know if there's been any triggers, if they've been exposed to anything, if they notice there's a little bit of breathing difficulty in the middle of the night. There might be a smoke hazard. They could have been exposed to cigarette smoke. It could be a high pollen count, so thunderstorms, all that sort of stuff. So we discuss this when a child is enrolled with asthma. We discuss what their triggers are, and then as educators, we need to be aware of that. So if there is a smoky day, we're not going to have the child outside. Okay, so I've noticed that Sophia is having a little bit of asthma. Mum and Dad said they'd given her a puffer before they dropped her off, and we're just going to have a keep a look out. So I'm going to read her plan, which is displayed in her room. You're going to get her spacer, you're going to get her face mask, and you're going to get her ventilator. You're going to double check that her name label is on it. And then you are going to check the date. So this is from January 2025. You're going to place it back in. You're going to put the mouthpiece on. We're going to shake it. So shake it once, remaining calm. You're okay, Sophia. We're going to have some yummy medicine. We're going to place our spacer in there, and we are going to do one puff and place the mask over the child's face. This baby is very well behaved, but most babies will try their hardest to squirm away, break free. Some people say the more they scream, the better, because they're actually getting in things. It can be quite distressing for other children to watch, so you'd probably go to a quiet area, or you would remove the other children from the area. Okay, good girl, keep going. So she's done 4 breaths. So then we do it again, we do our shake, place it in, squirt, back over her face, 4 breaths, and we're just being calm and we're just talking to her, and it's alright. So making sure that we have already asked someone as well to call her parents if we're thinking that it's not going to progress anywhere. She doesn't look like she needs an ambulance, but we will see. So this is my 3rd time. Place it in over her mouth. So big breath, Sophia, doing a great job. Breathing in, breathing out, and just being calm. And then last one. And spray, and then in. Alright, so, and now we're gonna, check the time. See how long we've got left, and then we're going to assess her. So, it's important now to try to reconnect with the child and just, say, you're all right, you're feeling better. Probably set a timer on your phone, the iPad, whatever's in the room, and you're going to keep watching her very closely. So maybe holding on to her, reading a book, distracting her for the 4 minutes, and then you're going to assess. So if she needs another 4, she definitely shouldn't be remaining at daycare. Sometimes it's not bad enough to call an ambulance, but the parents should 100% pick them up. So do you understand that? Would you feel confident having a go?
Yes.
Okay, so here is baby Sophia. And you might want to put her on your knee. So you've got your asthma first aid poster, which is just near you. All right, and it's all here in the cupboard. So you're going to notice that Sophia is not breathing very well. She looks like she might have asthma.
Like you're a little wheezy, struggling a little bit. So we're going to check her asthma plan out first, and make sure that we know which one's hers and all that stuff. Grab her Ventolin and make sure that it's her name's on it, so Sophia. Check the date, which is fine, so it's 2025. Spacer and mask. So it's just trying to get it all together with one hand.
Yep, so you could also shout out to someone in your room and say, can you assist me?
Yeah, so ask for assistance, or also ask that they take the other kids out initially, and we can just be trying to relax a little bit here. Pop it all in. Spray, and then pop it over her face, and then just trying to settle her and get 4 breaths in. So
sometimes it might be easier as well to hold the mask a little bit, because babies will be, like Sophia's very well behaved, but another baby might be.
Yeah, so it's just making sure that it's sealed across around the face, and that they're getting as much in as they can, and then coming away, shaking it up, back in, and then 4 deep breaths, just trying to settle and reassure, and hopefully the other staff member has probably come back at this point and has also made a call to parents.
Yep.
And then
So if it was a bigger toddler, like a bigger child other than our Sophia, say a 25 kilo toddler, would you remain sitting on that chair, or do you think you would sit up against the wall?
Yeah, and we'd sit up against the wall or on the floor, so that then we could have them relax a little bit, and also then get the medication in, so that if we needed to administer any other form of medication, like any other emergency care, we'd be on the right surface to do so.
Yes.
Yeah.
And our back as well. Our back, because if we, 4 puffs, if we did it 4 times and then we waited 4 minutes and we did it 4 more times, so that, we could be sitting there holding onto this child for up to 20 minutes. And we are rural, so often an ambulance is not available. So, it is really important that early childhood professionals are confident in this. So
Sorry, that was 4 breaths, and then just setting a timer, and we're going to wait 4 minutes. And in that time, just try and settle little Sophia, and make sure that she's in a nice, comfortable position, but also feeling like she's being comforted, so she can get some nice deep breaths in.
Absolutely. During this time, do you think it would be a good idea to offer Sophia a snack?
No.
Would you send her back out to play with the children? Like, she seems fine now, she's had her 4 puffs and she looks like she's fine. Would you maybe place her to bed?
I think she would just have to, I think she'd probably be very tired, although has had a lot of Ventolin. But I think she should be probably kept under more of a 1-to-1 supervision, not out with the other kids, not outside, and just in a resting situation, I guess. Like, not necessarily to bed,
sort of
but
quiet
situation.
quiet under supervision.
Yeah.
Awesome. So because you are in early childhood, then what's your procedure afterwards? So
then
this event has happened.
Once she's resting and the parents have arrived and that sort of thing, depending what the time frame is between that, getting a incident report filled in, making sure all the information's there, the time, the dosages, so that if she is going with the ambulance or with parents, they at least have all of the information, and all parties have documentation for what's happened.
Absolutely. Yeah. Awesome. Perfect. So could you step me through how perhaps you would talk if it wasn't Sophia? How do you think you would speak to, so I'll show you how I would speak to, a 6-year-old. So one of my preschool kids might come up to me and I could say like, they might say like, Heidi, I don't feel good, or my chest is hurting, and then they might have had an asthma attack before, so they might be really worried about it. So it's important, like, you get down onto their level and you're saying to them like, it's okay, I can see that your breathing looks like you're really struggling, but you know what, we've got some special medicine, we're going to put our spacer, we're going to have this, and we're going to have a go, and we're going to try to make you all better, going to call mum and dad, we're going to do it. So again, it's getting down on their level, we're grabbing, and we can even talk to them about it, because they're 6, so they're old enough. So you might say like, here's your spacer, your face mask and your spacer, and our Ventolin. So let's go, let's have a go at this, and let's see if we can just make this work out. We're just going to check the date. Oh, this is yours. We're going to put it in, we're going to do our puff, and we're going to sit with them, and we're going to just the whole time, so we're talking to them like, great job, I can see your chest looks like it's getting a bit better, like it's that really positive, we're being very positive to the little child, but we're making sure we're at their level, and it's often kids will get embarrassed. Kids are embarrassed when they have to bring this contraption out, so by the time they're 4, 5 and 6, they don't want to do it in front of other people. You want to take them away where no one else can see you. You would take them to a quieter spot, perhaps in the office, or you could sit down in the sick bay if you have a sick bay, or take them into a quieter room. So again, just to give them to relax, bring them down. So that is, so what do you think, how would you, if a small child came running up to you, would you address them? Are you going to why do you think we get down to their level?
Well, so they feel a bit more comfortable, a bit safer, and just, you can easily, communicate with them easier when you're not standing over them. And hopefully then they feel a little bit more secure and safe to talk to you about what's going on. And then, I guess it's about trying to reassure them, I assume, because, we at least would know the kids if we're working with them most days, and so we can at least have a connection, and sort of we might, we would know like what they like and don't like, so you might sort of use a distraction technique around just to sort of break the panic cycle a little bit, maybe. So if they love chickens, we can talk to ask them about their chickens,
bring out the chickens,
and if they like tractors, ask them about the tractor they have at home, something like that, so that it distracts them a little bit, and then take them to a quiet space, but also a space that's easily accessible if emergency services do need to come in.
Perfect. Well, do you know what? I think, is there any feedback you'd like to offer? Is there anything else, any questions? Do you have any questions for me?
I don't think so. I mean, so this is, most kids would already have had if they have an asthma plan and they have a preventer, they would have those before they come to school usually, or depending on what the plan is, you have to administer that perhaps. Some children
are on, during spring, some of them will be on a plan where they have 4 puffs every 4 hours, and that's just their daily preventative care. So it'll just be a prevention. So it won't be an asthma. So that will be written on their asthma first aid plan. So great question. All right. I'm confident, but I think you're confident. And I think if, do you feel that you could assist a child, at school, out in the community?
Yeah, I think so. Yeah.
Okay.
I do.
Awesome. I do have a feedback form for you, so I'll just get you to fill that out if that's okay, just so I can improve if I need to.
Great.
All right. Thank you so much for coming today.
That's okay.
And our next lesson, we are going to learn, again, early childhood setting, but how to administer an EpiPen and an EpiPen to a small infant. So that will be exciting. So we might revisit that this afternoon. All right. Thank you, Yasmin.
Thank you.